Hello dear parents, I am Dr. Praneetha, consultant pediatrician and neonatologist at KIMS Cuddles, Mahadevpura, Bangalore. So today in this video, we will discuss about a very common concern which is seen in neonates, that is spit-ups in newborns. So first let's understand how does spit-ups occur and why does it occur in newborn babies. They do occur in newborns because of their immature digestive tract. So there is a muscle which is separating the food pipe and the stomach. So this muscle is called as lower esophageal sphincter, and this muscle helps to keep the milk or the food in the stomach and prevent the milk to come back into the food pipe. So this muscle is underdeveloped in newborn babies, due to which the milk which is there in the stomach tends to come into food pipe and eventually come out through the mouth as vomiting. This is called as spit-ups. These spit-ups generally happen immediately after feeding, if you place the baby flat after feeding, or when the stomach is very full, or when the stomach is filled with gas while feeding. Typically the amount which is seen during the spit-ups is just few teaspoons to tablespoon, and it generally contains milk or sometimes curd-like, which is nothing but the digested milk. So most babies gradually outgrow the spit-ups by around 6 to 12 months of age as their digestive system matures and they spend more time sitting upright. Spit-ups are considered normal if your baby is healthy, active, feeding well and gaining weight. Although most of the spit-ups are harmless, you should consult your pediatrician if your baby is having the following symptoms. That is, if the baby is having forceful vomiting, not gaining weight, or vomiting contains blood or green colored vomiters, or if your baby is having signs of dehydration, that is dry mouth, or if the baby is having fewer wet diapers, which signifies that the baby is having lower urine output, or baby is crying after feeding. Though the spit-ups are normal, you can follow few practical tips to decrease the frequency of the spit-up. The practical tips are, you can hold the baby upright during feeding, that is, the head should be at a higher level when compared to the rest of the body, and hold the baby upright for 20 to 30 minutes post feeding. And you can burp the baby during and after the feeding. Avoid overfeeding for the baby and avoid putting tight clothes and diapers that puts pressure on the abdomen. To summarize, spit-ups are a normal physiological phenomenon which occurs in newborn babies, and most of them outgrow by around 6 to 12 months of age by the time their digestive system matures and they are sitting upright. By following these few practical tips as suggested before, you can decrease the frequency of the spit-ups. And be watchful for the warning signs which were told and consult your pediatrician as needed.